Hey girl, hey, this is Dr. Tasha Rogers and I am back. Um, Forgive my appearance. I am a little bit exhausted, but I wanted to make sure I got this video up for you guys. It's going to be a little bit of a detailed one, a lot of information in it. I got so many requests and I've been getting requests for a long time to do this particular video. And I'm like, you know what? Let the girl just do it. I don't know why. This is not one of my favorite topics to talk about. And I think because it's one of those topics that a resolution is not easy. At the end of it, it's like, oh, hope you feel better. And I hate things like that. Like, I really like to solve problems. It's the Virgo in me. But today we're going to talk about endometriosis, okay? A lot of people hear about it. A lot of people are told certain things about it. And let's really kind of get into the meat and potatoes of it, because people kind of like fake diagnose endometriosis all the time. And it is really a serious condition. It really can be very debilitating for some people, but let's talk. So first of all, endometriosis affects way more people than you would think. It affects about 10 to 25% of people. And yes, I have notes because I had to keep my thoughts straight, because y'all know I stray all over the place. But it affects 10 to 25% of women. Okay. And what is endometriosis exactly? So what happens is, the lining of your uterus, and the easiest way to think about a period is like this. So every month, oh, I got a string. Every month, the lining of your uterus builds up like a lawn. Imagine your lawn growing. So the lining of the uterus builds up like a lawn. If you do not get pregnant, then you bleed that lining off. That's what you're bleeding off every month, is the lining of your womb. Well, with endometriosis, that lining somehow, and we'll get into the possible hows, somehow gets outside of your uterus. So instead of bleeding out and coming out of your womb through the vagina and out, it somehow backs up, goes through the tubes somehow, and comes out and gets into different parts that it shouldn't be in. It could be on your ovaries. It can be on your bladder. It could be on your bowels. It can be almost anywhere, but inside of your abdomen. And so what happens is every month when it's time for that period, that tissue, even when it's outside the uterus, that tissue grows. And it's itty bitty little bits of tissue, but it grows just like the tissue on the inside of your uterus is growing. That tissue that's on the outside of your uterus starts to grow. And as you start to bleed that off, as you're bleeding on the outside, you're also bleeding on the inside. And so that's why there's so much pain. There's blood in the inside of the abdomen, and it hurts, and it's nowhere for the blood to escape. Right? And it just causes a lot of pain. And with that blood being in the abdomen, it also causes scarring and scar tissue and inflammation and all of the things. I'm going to get into really specific how endometriosis works, okay? But with each cycle, you have that. Just like you bleed on the inside of the uterus and it comes out, you're bleeding on those parts that's on the outside of the uterus, whether it's on the bowel or the bladder or the ovaries. And sometimes where the implants are can have some effects on your symptoms, but not always. It doesn't necessarily coincide, all right? But with all of the pain and the scarring and all of those things, that's why when you have endometriosis, very easily it can play into infertility. 35% of women who have infertility actually have endometriosis. Okay, now there are stages of endometriosis. All endo, we call it endo. All endo is not the same. So you have stage 1, 2, 3, 4, and obviously 4 is the worst. 1 is the least, but please understand, it doesn't mean that if you have a 1 that you have any less pain than if you have a 4. And some 4s are asymptomatic, like they don't feel anything, they don't know anything. But a 1 can be in a crazy amount of pain. So don't think because somebody's a 1, you can discount them and be like, oh, she's a stage 1 endo. No. Okay, endo is endo when it comes to pain. So stage 1 we call minimal. Okay, and that's when the tissue is kind of like on the outside of it's come outside obviously, but it hasn't like really implanted it hasn't like stuck its teeth in anything. Stage 2 is mild, and that's when it's kind of like stuck its teeth in some stuff, but it hasn't really spread. It hadn't started acting a monkey yet, but it's digging in. It's digging in. Stage 3 is moderate, and that's when it's digging in. It's kind of spreading to the side. It's doing stuff. It's in there moving and doing stuff and rearranging and doing all the things, okay? And then stage 4 is severe. That's when you have scar tissue. That's when you have, let me see here what I put. You have cyst, which we call endometriomas. You have scar tissue, you have scarring. All of that can lead to infertility. You have digestive issues, so many different issues and problems. Stage 4 is what we call sometimes a frozen pelvis. And that's just the scarring. It's just holding that uterus down like you've had abdominal surgery. It is bad. And yes, that is associated with infertility most times, okay? So we got it. The stages are stage 1, 2, 3, 4, and that's going to be minimal, mild, moderate, and severe, okay? Now, when it comes to endometriosis, it's like, well, what are the symptoms of endometriosis? Because everybody's going to tell you something different, or everybody's just going to jump on painful periods. Oh, you got endometriosis. That's not true. Painful periods is called dysmenorrhea, and they're just that, painful periods. But it does not mean that because you have a painful period, you have endometriosis, okay? So the symptoms of endometriosis are painful cramps. It can be heavy periods, and it doesn't have to be all of these things. It can be some of these things, okay? But painful cramps, heavy periods, fatigue, pain with intercourse. You have pelvic pain all the time. You could even have low back pain. You can have pelvic pressure. You can have painful bowel movements. It can be painful urination. Again, if you have implants on that bladder, that's where it's going to come from. So don't always assume, oh, it's hurting when I pee again, I must have a UTI. No. Make sure you guys are getting full assessments and not making self-diagnosis. Y'all know I hate that. And it's also with the periods, a few things will happen when you actually have your periods outside of the pain. You can also have diarrhea, constipation, bloating, and nausea. Okay, so all of those things can encompass or can look like a picture of endometriosis. And you say, well, why? What causes it? We don't know. We don't know. One of the thoughts is what I was telling you about the tissue going back. What we call retrograde menstrual periods. Retrograde meaning instead of going this way, it's going back, retro. So it's going back into your pelvis instead of flowing out of your uterus. But we don't know. Years and years ago, there was a question as to whether there was a genetic link. But again, we're still not sure. And it's difficult to say because you're like, oh, my mama had it, so I have it. Well, you and your mama lived in the same house, and 9 times out of 10, lived in the same house, drank the same water, ate the same food, breathed the same air, used the same laundry detergent. So is it environmental or is it genetic? But we still don't know. And what we're going with right now is the retrograde menstrual periods, where instead of the tissue, or at least all of the tissue, there's some type of dysfunction, but some of the tissue goes back into the fallopian tubes and goes back into your abdomen. Okay, so those are generally going to be the causes of it. Now, when people talk about endometriosis, people only sometimes want to talk about the physical aspect of it, but I do want to talk about the mental aspect of it too, because it is very hard on women. When you have endometriosis, is associated with depression, chronic fatigue or fatigue, anxiety, as well as headaches. So, women who suffer with endometriosis tend to see these things as well for obvious reasons. And then some not so obvious when it comes to, hormonal levels and things like that. Now, we're going to get into a whole lot of stuff, guys. Diagnosis. And this is the part where I love, and y'all are going to clutch your pearls. I'm going to clutch my Dylan Lex, but y'all are going to clutch y'all pearls because y'all are really going to be interested to understand diagnosis of endometriosis. There are 3 things that you need for diagnosis, and not necessarily 3, really 2. So pelvic exam. Nobody can really say this, that, or third without putting their hands on you. I can't understand when people are talking for, oh, you sound like you have endometriosis. What the hell does that mean? How can you tell the difference in somebody who has real bad periods and endometriosis? Well, I'm going to tell you. Okay, so pelvic exam, you need an experienced person to be able to put their hands in there, see if things are moving around the way they should be moving around, see if things are articulating. Does it feel fixed? Does it feel firm? Does it feel like your uterus will not move? And it's not always possible to know on exam. Some people are bigger than others. Some people may not have a stage 4 endo. You may have a stage 1 endo. So no, and a pelvic examination is not going to tell you everything. The next thing we generally will do is a pelvic ultrasound. Child, you know, when it's GYN, you come in and say you got, well, everybody get an ultrasound. Everybody get an ultrasound. And the reason is because it gives us a lot of information. We can't, I mean, it's kind of like the first glance inside of your girly parts, and to, I guess, to call it, or, you know, your pelvis. But what we're looking for the ultrasound is endometriomas, or we call chocolate cysts, or they're cysts that are on the ovaries or round about the ovaries, and they're actually filled with blood, old blood. And when we operating on them, it looks like chocolate, because it literally is like brown in the consistency of like like a melted chocolate. That's what it looks like when we're operating. So we call them chocolate cysts, aka endometriomas. And so for ultrasound, that's what we're looking for to help make a diagnosis. Okay, and then the next thing here is what you guys need to understand. Are you listening to me? If you're not listening to me, I'm gonna give you a minute so you can listen, so you can hear me. Endometriosis is a surgical diagnosis. If somebody has not taken you to the operating room, they cannot with 100% certainty diagnose you with endometriosis. It is a laparoscopic diagnosis. What does that mean? That they have to put the camera in your belly, see endometrial implants, okay? They have to see them outside of the uterus, see them, look at them, and then say, okay, this person has endometriosis. And still, what we'll try and do is we'll try and grab a little bit of that tissue and send it to the lab to make sure it says endometrial lining. And then you have your 100% confirmed diagnosis, okay? But that is the only definitive way that somebody can diagnose your endometriosis, okay? And oftentimes what they'll do when they're in there to help with pain, or sometimes, you know, to help with or treatment, but it really kind of helps, is to burn those endometrial implants. And so we have, you know, some areas you can't burn. If it's on the bowel, can't burn the bowel. You know, on the bladder, can't really burn the bladder. But there are some areas where it may be on your tubes, on your ovaries, on the outside of your uterus, just kind of sitting up on the roof of your uterus. And we tend to grab, it's called a bovie, but we grab like a little hot needle or a hot knife, and we bzz, 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 and we burn those implants. So at the end of the day, that is your diagnosis. And then sometimes we can actually improve how you feel or your symptoms, at least for a short period of time, with burning the implants. Does that make sense? Okay, so now let's get to treatment, all right? And I went all in on treatment because I feel like when something is so non-conventional and it doesn't really have definite answers sometimes, like why and how, I feel like when the answers or when the questioning is not very conventional, then the answers can't be very conventional, if that makes any sense. So let's kind of get into it. When it comes to endometriosis, it's a few different things I'm going to touch on. The first thing is medicine. Okay. When it comes to medication, first thing, birth control pills. Now, I know y'all like, I don't want the birth control, I don't want the hormones. First of all, the hormones, what it does is, and people really give birth control pills a bad rap, unless you have some type of bleeding disorder or some type of true contraindication to taking birth control pills. If you do, please don't take them. Okay, but if not, this is for you. First and foremost, birth control pills. Let me dispel any myths. And no, they're not going to make you gain weight. The only thing that makes you gain weight is Depo-Provera. Nothing else makes you gain weight. That was birth control pills back in the day. I don't know who's still talking about that, but no, you're not going to gain weight with the birth control pill. As far as birth control pills go, it is not going to delay your fertility, especially not in the case of endometriosis, and I'm going to tell you why. It actually is very protective. Birth control pills in general are very protective. They protect you from endometrial cancer. They protect you from ovarian cancer. They protect you from ovarian cysts. They make your period shorter, lighter, and more comfortable. Did you know that every time? Okay, sorry about that. I had to click on the other line. Anyway, so when it comes to ovulation, did you know that every time you ovulate, you use up about 50 to 100 eggs with every ovulation? Only the most mature egg, the most superior egg, actually makes it to the ovulation and the rupture. The rest of them kind of like fall off and die. Okay, but did you realize that? But when you're on birth control pills, it actually prevents you from ovulating. So you're actually saving your eggs. So that is very, very protective. And when you have endometriosis, it kind of keeps it at bay. The estrogen and the progesterone in the birth control pill keeps the endometriosis calm. It keeps it quiet. Just like, think about this, if it makes your regular period shorter and lighter and more comfortable, so what is it going to do for those implants outside of the uterus? Same thing. The periods or the bleeding will be shorter and lighter. So it is definitely of benefit, but again, it's something that you need to talk to your provider about, and it needs to be a personal choice. All right, but I'm all for it. NSAIDs. Now, NSAIDs are like your ibuprofens, your naproxens, your Advils, your all the things. The NSAIDs, the non-steroidals. Those are great because not only do they treat the pain, they also treat the inflammation. So if you didn't know, for ibuprofen, 600 milligrams is the inflammation dose, and that'll control any inflammation in the pelvis. 800 milligrams is the pain dose. So please don't exceed what the daily allowance is supposed to be, because you will straight kill your kidneys. Let me be clear with you. So you might want to stick within, and if the pain is not being controlled, then talk to your provider and go for something else. But please, 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 please do not exceed and be like, oh, well, if I can take 800 milligrams of ibuprofen, let me just take 2,000. Don't do that. Don't do that to yourself. Do not do it. You will lose a kidney. I've seen it before. Don't do it. Okay? Stick with the recommended dose. But NSAIDs will not only help with your pain, they will also decrease the amount of inflammation in your pelvis. Also, there is a new pill, and I'm going to be very honest and say, I mean, it's new. I don't treat a whole lot of endometriosis. I don't see a lot of endometriosis, praise the Lord in heaven, because it is not easy to treat. I feel sorry for you ladies, and y'all get frustrated, and I get frustrated because I can't fix y'all in its entirety without surgery. So, woo. But anyway, there's a new pill called Myfembree, and it's spelled MYFEMBREE. And it's kind of, I guess it's like a twist on a birth control pill, but it's supposed to work for pain and bleeding associated with fibroids as well as endometriosis. So even if you have that trifecta or that dual factor of the painful periods, endometriosis, and fibroids, Myfembree she's going to be your friend. She's that girl. So make sure you guys are asking your provider about it. Please know and understand it is brand name, so y'all know what comes along with that. But talk to your provider about it because it's relatively new. And right before she came out, I want to say last year or the year before, maybe 2 or 3 years ago, Orlissa, and it's ORLISSA. Orlissa came out, and that is for pain associated with endometriosis. And there's a couple of different doses and a couple of ways in which that would be prescribed for you. So again, if you are feeling like you may have endometriosis, we talked about how to get diagnosed with it. We talked about the definitive diagnosis. We talked about the symptoms, and now I'm telling you which particular medications to look into and to take to your provider and say, hey, what about these things? If these are things that you don't know about or you haven't discussed with your provider, okay? Now, let's talk about surgery. Again, the laparoscopic, it is, again, for diagnosis, like we just said, and to remove the endometrial implants. The only other surgery that I'm well aware of is hysterectomy, but here's the deal. If you have gotten to the point where you're like, I'm over it, I can't deal with it, this pain is miserable, or you have gotten to a point in your treatment plan with your provider that you're going to have a hysterectomy, guys, can I say this? Because I've seen something different happen over the years, and it pains me. Like, it really hurts my heart, okay? The ovary controls your menstrual cycle, okay? I know we got this buildup in the uterus and the lining and the implants, but your ovaries control your menstrual cycle. And so, I don't know, I think a lot of doctors feel out, if I take the uterus out, then there's no more lining. And it can't, but yes, you can have implants that you can't see. You can have implants on the bowel. You know how big the bowel is? The small intestine alone stretches out to a football field, Okay, like it can be on the large intestine, it could be on the small intestine, it can be hiding, it can be. So if you truly want to be rid of endometriosis, the endometriosis symptoms, the endometriosis pain, if you truly, you have to remove the ovaries. And unfortunately, yes, that throws you right into menopause. Not one ovary. Oh, I took out one of your ovaries. What then? If you have a piece of an ovary, if you have a piece of an ovary, it's the same as having two. Okay, so if you truly are like, it has to all come out. Okay, and yes, that throws you directly into menopause. And yes, obviously that can be treated, but the reality of the situation is the ovaries gotta go. Okay, so I hate that for anybody who didn't want to hear that, but it's true. Now, let's take a step back, okay? Let's look at some herbal medicine. Now, again, you guys know the way that I feel is that herbal medicine is definitely a way to attempt to maintain, attempt to get in front of things, and an attempt to work in conjunction with your current treatment, not to be used instead of. That's how I feel, but you know, I listen, I don't judge. And it's not my body. I'm not in it. And we do what we have to do. We do what we need to do, right? Okay. So a couple of herbs. And it's a couple, one or two of these I hadn't heard of. And I was like, well, let me look this up because I don't know. But turmeric, y'all know turmeric is good for everything. Turmeric, if turmeric ain't gonna do nothing, it's gonna get at that inflammation. Turmeric is amazing. It just makes you feel so comfortable. It makes you feel, I don't know, it's like nature's ibuprofen, if that's a word. You have chasteberry, okay? Dandelion root, ginger. You know, ginger gonna get at that inflammation too, baby. Ginger is not playing with you. Cat's claw and wild yam root. And wild yam root also is good for like, if you are menopausal, it helps with hot flashes. It helps with a lot of different things. So again, turmeric, chasteberry, dandelion root, ginger, cat's claw, and wild yam root. Okay, so those are some, please stop. Y'all don't be taking everything together. Don't be at the house with a big, cauldron, put everything together. No, and then some of these things can be teas. So I would definitely say go to an herbalist, figure out what's safe to take together, and figure out, one may be a tea, one may be a capsule. Turmeric, sometimes you could put on your food. Ginger, you can eat. So, everything doesn't have to be a pill popping expedition. But I would definitely say get with an herbalist and figure out a safe way to incorporate these things safely. Because I'm not saying they can all be taken together. I don't know. I'm not an herbalist. I stay in my lane. But these are the herbs that are going to be good to help with endometriosis. Okay. Now, rounding this thing out, let's talk lifestyle. Okay. Let's talk lifestyle. Y'all never want to talk about this. But first and foremost, an anti-inflammatory diet. When I'm talking about an anti-inflammatory diet, I want you to think like Mediterranean diet. Think non-processed. Think as few carbs as possible. Think as low sugar as possible. That crap is poisonous to your body and to your system. Excuse me, guys. So please think anti-inflammatory as much as you possibly can. Okay. Alkaline water. Now, I know that at the grocery store, you see a lot of things called alkaline water. If you want my recommendation, go to an herbal store, go to a natural store. There's a halal market that I go to get water. There are some herbal stores, but I do CHA water or chai water. There's a couple of different types of alkaline water, but alkaline water. Can I give you guys a secret? If you don't pick up anything from this video, y'all ready? Okay. I'll hold on, I'll wait. Because I need you to hear this. I need you to lock into this. And if you need to look this up and do your own research, I promise you, you will find what I'm telling you. There is no disease, not even cancer. There is no disease, nothing, no disease at all that can thrive in an alkaline environment. So if you make your body as alkaline as possible, you're fighting disease. And you can look it up, which foods are alkaline, which vegetables are alkaline, drinking alkaline water. That is a start. You have to give your body all the ammunition in the world to fight not only this, but every disease. So try and be and try and remain as alkaline as possible, okay? You heard me, you heard it here first. Also, exercise, okay? It is very, very important that you exercise. When you have endometriosis in life in general, but especially with endo. And the things that actually help with endo the most are aerobic exercises. So aerobics are going to help you. That's walking, biking, swimming, anything aerobic. And what it does is that decreases your estrogen levels and it decreases your inflammation. So we want to get that, we want to get those aerobics rolling, okay, so that we can control that endo. All right. All right. Now, also, as far as self-care is concerned, people don't tend to think, mind, body, and soul, mind, body, and soul. They look at the body, they might consider the mind, but at the end of the day, you have to treat your whole body. You have to treat your whole body. And I say, as much time as you took to get your hair done, as much time as you sat for all these braids, these boho braids, as much time as you sat for somebody to lay your lace or a relaxer or one of the natural styles under the condition, as much time as you did for that, for your nails, for your lashes, take that time and take care of the inside of you as well. Meditate. Relieve as much stress as you possibly can, or figure out stress management techniques and which ways to deal with stress. We're all going to have stress. Life is always going to life. If you're waiting for life not to life, you're going to wait forever, because life is always going to life. I don't care who you are. We all have our own discrete set of problems, but we all have problems, okay? So just be very mindful of that. When it comes time for your period, or when you have any discomfort, heat is always going to work well. So a heating pad when you're in pain is perfectly fine. Obviously, don't put it directly on your body. You want to have something between your skin and your heating pad, be it, a t-shirt or a towel or whatever it is, but no heating pad or no heat directly to your skin. We don't want you to have any burns. And again, stress relief, if that is walking, if that is praying, if that is meditating, if that is journaling, you have to get your whole body in a place of wellness. Again, in order to combat endo. Warm baths is okay as well. Now y'all know how I feel. Nothing's supposed to go in that bath water. Not a thing. Not a thing is supposed to go in that bath water. Get in a bathtub with just water. It's okay. Like the bubbles, that's for the kids. No, don't do that. Also, I want you guys to start to consider something. I'm a big proponent of it. I think I'm going to start to really get more into it this year. I'm going to try and find a Chinese medicine doctor here in Atlanta, one that's good, because Atlanta, child, somebody open up a storefront and act like they got a certification, act like they know how to do something, and girl, no. But I'm going to do my research, and if I have to even travel outside of the state, I am. But I'm definitely this year going to get more focused into Chinese medicine, and that is an amazing thing when it comes to endometriosis too. Acupuncture and Chinese medicine, they have a whole different set of treatment, whole different set of herbs. They do a whole thing, a whole different way, but it works. Do not think that Western medicine is all you have to or can resort to. Eastern medicine is that girl as well. So don't be afraid if you're like, I don't want any surgery, I don't want to do this, and you feel like you're backed against the wall, then start looking at acupuncture, start looking at alternative therapies like Chinese medicine and different things like that, because they work. And when it comes to endometriosis, there's no one set way to do things. It depends on, what is happening with your life. It depends on where you're trying to go. It depends on, what stage endo you have. But if I can also offer anything else, I would certainly offer egg freezing. Egg preservation, I think, is a major thing, because just in general, I recommend it to my patients started about 24, 25. But egg preservation is a major thing, because let's stop and think about this. Let's say for whatever reason you don't notice that you have endo, you don't realize it, you may not realize it until something comes up, and you may have inadvertently have another surgery for something, or you may not realize it's as severe as it is, and then we have infertility issues. Sometimes we may not find that out until 38, 39, 40. Well, at a certain age, if you go for in vitro, they don't want to use your own eggs because the failure rate is too high once you get to a certain age. So they want you to get donor eggs. So imagine the first time you're hearing, okay, you can't have a baby. You can't have a baby by the natural, traditional, whatever way, however you want to say it. Your uterus is not amenable to having a baby for whatever reason. And you have to deal with that. You have to contend with that. Then you finally are able to say, okay, let me go speak with the fertility person. Then they're going to say, okay, you have to do donor eggs. So of course it will be your baby, but not the same genetic material. That's a lot. That is a lot to have to see, endure, swallow, and then share with another person or other people. So I always say, if possible, if it is financially feasible, even if you don't have endo, even if you feel like you're healthy, anything can happen. Cancer can happen, an accident can happen, fibroids can happen, anything can happen. If it is feasible for you, please, please, please do egg preservation, because if we have, your genetic material, we have your eggs, even if you have to have a surrogate, even if you have to have a family member act as a surrogate or hire a surrogate or whatever the case may be, it's your genetic material. So, and not that that matters. I'm not saying that it does not matter whether it's your genetic material or not. A mother is a mother. The mode of delivery doesn't matter. The genetics doesn't matter. A mother is a mother. But it matters to some people. And like I said, I never want somebody to hear something the very first time when they need it. I don't think that's fair. So I think that people should kind of know going in. If you're 40 and somebody says, yeah, it's donor eggs, you're not my patient gonna say, oh, well, I didn't know that. No, you knew. And sometimes, it's an expensive process and insurance doesn't always cover it, but sometimes it does. So make sure you guys are asking, hey, does my insurance have a fertility rider? Hey, are you covering any of this stuff? Because for a lot of my patients, it was covered. You just had to ask, because they sure not gonna offer. Okay, so I hope this blessed somebody. I hope it helps somebody. Y'all have been asking for endometriosis for a long time, and I finally did it for y'all. I'm sorry for the delay. I love my girlies. But please share this, tag people in this. Click. If you're not a subscriber, please subscribe and click like before the end of this dang on video. Y'all be all up in it, forgetting to click like. Y'all be playing in my face. So click like and please share this video with anybody who you think can need it, who needs it, can use it, can benefit from it. Just keep sharing it. We want to get as much accurate information circulated so that people can benefit and share in their journey with others. And if they're doing things that may not be conducive to their condition, but they don't know, hopefully this will help somebody. So thanks for watching, and it's Dr. Tasha, and I'm out of here.